Hi, my name is Tristan Smolarczyk. I know the rubric thing said to take a high quality video, but this is about as high quality as it gets for me. I'm in the ATTR 354 preseason athletic training class. This past week, I got to participate in 6 standardized patient encounters as well as a couple of just kind of skills practice tests. Personally, going into it, I was really nervous until I was told that these are pretty low risk. You're just gonna go in, do your thing the best you absolutely can, and walk out, and that we're just gonna not necessarily be graded over it. They weren't for a grade, they were more for practice and for skills assessment, which I really appreciated. It made me calm down from being a nervous wreck. Walking in, I felt a little bit more confident, a little bit less nervous, and just, I was more patient-centered. I felt pretty good about the encounters. I know it wasn't the best, and I know I can get better, but the fact that I know what I did wrong, I feel pretty confident that I can do that much better the next time. Honestly, going into the encounters, I felt I had done a really great job in staying patient-centered. I had introduced myself every single time, asked the patient their name, or at least said it if I was like, is it Maria or something like that? And I would always just make sure I had their name down, ask them what's going on, try to be as relaxed looking as I could so the patient wouldn't freak out and they'd feel relaxed as well. I felt like every time I went to leave, I'd ask them if they had any questions, as well as I'd shake their hand again and tell them that I was sorry I couldn't help them more and I'd refer them out, or I would tell them I had a great time working with you, hope to work with you again, and if you have any questions, don't be afraid to ask, and as well shake their hand and walk out. So I felt like I did a pretty good job going into encounters as well as leaving them. I didn't really leave in as awkward of a situation. Some things I know I could have improved on. Some patients I did really well at doing range of motion and manual muscle testing. Some patients I kind of skipped it. And I did use best judgment, but at the same time, I know I need to stay focused on doing the whole package, because if we want to get to a point in athletic training where we're taken more seriously, we need to have that information, kind of like a physical therapist. They have to have their information to get reimbursement, and I know that's something I need to work more towards myself. When it got to the upper, I completely just threw dermatomes, cranial nerves out the window. And I definitely know when it comes to a concussion, has probably something you should assess. Any kind of head injury, you should probably assess that. And I just skipped it completely. On the one patient, I gone through the SCAT 3 and I was like, no, I'm missing something. Not the SCAT 5. I was unaware of that. I had skimmed through that article, but I completely skipped the SCAT 5 part. But I was trying to do SCAT 3, skip cranial nerves, and I didn't do as well of an assessment in checking to see if there's any bruising. I couldn't really see in the dark room, as well as I'm kind of blind. I do know I need to do a better job in just kind of checking for bruising, and as well as asking about if there's any swelling, because otherwise it's a fake patient encounter. Not many of the injuries are 100% real, so I might not see a whole lot. I feel like some of the patients I did really well in trying to make sure what the patient's comfortable with, and I would warn them if I think something's gonna hurt. I'm like, look, I'm gonna touch around on this, I know it's gonna hurt, but just bear with me, and they're like, okay. I did well in making sure I could actually see the skin, so I'd ask the girl to take off her shirt if she was wearing a sports bra, so I can work around with the shoulder or try to palpate and feel for things. The guy with the back issue, I would ask him, hey, can you lift up your shirt for me if that's okay? I'm just going to touch around. And he's like, alright. Not really touch around, that's kind of bad, but palpate. Honestly, I feel pretty good about my patient encounters. Like I said, they could have gone better. There's a lot of things I could have done better. I just think I felt overall more uncomfortable with the situation because I didn't know where everything was. If it was my athletic training room or an athletic training room I'd worked in, been shown where everything was first going in, and then a patient comes in doing something, I'm going to know where everything is right away. Oh yeah, that's where that is. Like with the exertional heat illness one outside, did not know where the cooler was. I was actually instructed where it was wrong, so I went to the wrong area for it. Patient probably was close to death. I just think that I just need better information on where everything is. I need to have a set, not necessarily schedule, but like routine of how I'm going to go through things, as well as keep an open mind. So if something like systems change, like if it's one injury, then kind of make it a little bit more flexible of a routine. I know I could have done better, but I feel like I did really well for having 3 months off. I feel like these encounters really kind of opened my eyes and prepped me for this preseason internship I'm going to jump into, because I didn't need, after almost 3 months of taking off, I needed that a little bit of introduction back into it, and I feel a lot better because I had not done anything athletic training involved this past summer, and so I feel like that really helped me as just kind of get back into it. And I feel like definitely in the future, if I encounter anything like those, I'm gonna have a better routine, know where everything's at, as well as the debriefings that we had made me feel a lot better, kind of better informed me for certain situations, like if you break your butt, you need a donut, anything like that, like kind of thinking about things you typically wouldn't think of, like transportation. How are you going to transport this person, because what if they can't drive themselves? So I definitely think it's going to help me think a little bit more ahead for the future whenever I'm in those situations. But otherwise, I feel really good, and I'm really happy we actually got to do stuff like this. It just made me feel better and more confident overall.